comments. Travis, how's it going, man? Like it's been so long since we talked. Okay, let's go live again. We're live on LinkedIn. Now we're live on YouTube. And you guys are lucky you just got questions. You just got a free job lead your way. Okay, and that person very timely. It was destiny that you're watching this live stream on Instagram because it sounds like that job has your name all over it. Can you guys hear me okay? Travis. Yeah, Vince. It's funny, man, but they've been asking. They're already asking. But I think we have a really good group this January. It's like quiet, but seems to be a lot of good people in there. Okay. Greetings. Here's a question. Greetings. I'm currently watching the 5-hour YouTube video as a review. So thank you very much. And by the way, make sure you subscribe and you like and you comment. Okay. The YouTube algorithm wants to see all that. Okay. So make sure you do all those three things. The YouTube overlords need to show my videos to more people. So I'm currently watching the 5-hour. I see them in Slack now. Yeah, Salesforce. Salesforce just bought Slack. Absolutely. Absolutely. I'm currently watching the 5-hour YouTube video as a review and not sure if you will discuss the pros and cons on working for a private site versus a university. I'm wondering if you would share your experience or knowledge on that matter with me. So, I have only worked for private sites. And however, as a monitor, okay, because I'm not even a good person to answer this question for working in private sites either, as I am for university. I mean, I've never worked for university, but as a monitor, okay. Oh, now we got the comments coming in. Gazelle, we need answering questions is gonna be impossible on live streams because I get distracted. Okay, Victoria Welch, how's it going? So Gazelle, please email me or direct message me. I need you as a guest lecturer on the CRA Academy whenever you can. Uh, please, thank you so much. I was thinking about that the other day. Hello, Swapna, Vertika, Danny, great name, Eduardo. Um, been a fan, follow of yours. Yeah, thank you. Make sure you like and subscribe. Hello, all. So the question is, can you discuss the pros and cons of working for a private site versus a university? I'm wondering. So the disclaimer is I've never actually worked for either. Okay. I've owned private sites. I've never worked for a university. And I've never worked for a private site outside of the ones I own. But my experiences as a CRA, I think, come in handy to answer this question because as a CRA, I'm just a CRA. Okay, Gazelle, I'll call you. Because as a CRA, I'm in a different context. So, like, I'm looking through the other side. And so as a CRA, I've monitored private sites and universities. And let me tell you, yeah, private sites use central IRBs, and then universities use local IRBs. Uh, it depends what you want to do with your career. Okay, if you've been following for a long time, which I don't think you have, you will soon learn that I'm a big fan of being a generalist. Okay. And somebody else is commenting as a CRA, I prefer monitoring. Um, which one? You're leaving us hanging. Okay, which one do you prefer monitoring? Uh, I prefer monitoring private sites as a CRA. And some Albert says that both central and local IRBs can be used. So this back to this person's question about their career. Okay. I am a fan of being a generalist for your career. Meaning, if you go to work at a university, first of all, it's a great place to get started, but you can get lost in the mix and you can get stuck and in certain roles, and then pretty soon you have no chance to become a generalist. At our private site, our employees are family. Everyone I know that works at academic sites are numbers. Yes, exactly. Monitoring private sites central IRB makes life 10 times easier. I agree. So this person, um, as a monitor, you don't really care. You're just doing your job, whether it's a UCLA that you're monitoring or a private site in Los Angeles that's a small mom and pop site. You don't really care. You just want to do your report. When you're asking me uh, where you should work, I think you should go private site. Number one, more of a generalist. Number two, you can do more things, wear more hats. So I guess that's still related to number one, being a generalist. The family thing is more real. There's more of a culture at those at private institutions versus academic institutions. Each time, I don't know why, but each time I go at an academic institution, I just get the impression that nobody wants to be there who works there. Like everyone's just there because they have to be. And at private sites, it's kind of the same, but you can tell it's a different kind of culture, different kind of vibe for the most part. So the pros of the only pro I can think of working at a university or academic center is, I guess, prestige, for whatever that's worth. Um, Even that, I'm saying it with like disdain on my face because I don't think it's worth all that much. At our private site, so see, you're just like numbers at those other places. Exactly right. Um, Prestige, maybe better benefits, although a lot of private sites are offering benefits as well. Trying to think of what other pros there are. If you like streamlined, like if you cannot function, like if you can't think outside the box, then a university setting, academic setting would be best for you because you're just told exactly what to do every single day. Like it's the same thing every single day. Um, People are also saying I see more workload at university. Coordinators get to internal QC more at private. Not sure if you get that experience in academics. I haven't seen that in academics. Honestly, at the academic institutions I've been to, um, people don't want to even do their own jobs. Never mind someone else's job so that they can put the experience on their resume. People are not even thinking that way. Now, there's nothing wrong if you are somebody who needs organization. Like there are a lot of people out there that I've learned over the years that need organization. Uh, I need to be in a chaotic environment to function better and be more myself. I'm currently a contracted CRC with a patient recruiting company and want to start my own. You can. You have everything. You don't need anything for that kind of business. It's a complete virtual business. Randy, if you need patient recruitment, look at patient. Yes, reach out. Also, to go to the Patreon channel, patreon.com/dansfera, and learn how to be a patient recruiter. We have many people in that group that are patient recruiters. So I think being at a private site is much better for your career, right? You're not going to get boxed in. You may not get as good benefits or retirements or all that stuff, but you can do that stuff on your own. Okay. You can create your own IRA, retirement account. Uh, Health insurance, kind of, I mean, you're guaranteed to get that at the larger places. At the smaller places, you might have to get private. Sometimes they offer it. It just depends. Okay. So I guess that's the pros. Um, but yeah, make sure that you go to patreon.com/dancefair, check that out. So being a generalist, like learning, like this last person who's been a coordinator for 16 years and wants to be a CRA, like if you were a coordinator for that long at a university, you could still be a CRA. 16 years is a long time. But I guarantee you, if you compare like your duties from somebody, like take somebody with the same amount of years, let's say 5 years at a academic center versus 5 years at a private, smaller mom and pop kind of place. That person at that mom and pop place has a much more holistic view of the industry. They've probably quality controlled, QC, their other coordinators. They've probably been cross trained on other studies. So even though you've only done certain studies officially as the coordinator, you've probably been a backup coordinator on other studies. So now you're putting all this stuff on your resume. So I think going the private route is best. Anyone else have questions? Yeah, Lee is the guy to know. Lee at patientmds. For sure. Okay. Make sure you guys do that. Is that for patient recruitment? Patient recruitment is a way to get your feet wet in the industry. Anybody can do it. If you don't have experience in clinical research, patient recruitment is one way to go. Another way to go, I think, is even easier, is business development for sites. So, learning how to get study leads, not necessarily getting the studies for sites and securing studies, but getting study leads. So you can go on clinicaltrials.gov all day long, email people about studies, and then take those leads, the ones that say, yeah, we're interested, send us your PI's info. Now you can take those leads to clinics in your area and say, hey, I have a lead for you. I don't know if you have this study yet, but I'm, through my business development outreach efforts, I've been able to get interest from this sponsor on this particular study. And by the way, I'll do this for you for free, but I want to be a coordinator. And if I can just shadow, intern, if you guys like me within 3 months, hire me. If not, I just want the experience. I mean, this is what you guys got to do. This is what you guys got to do. For sites, is it a good idea to just hire somebody for patient recruitment? Yes, it is. You can outsource it. I've heard good things about Study Kick, but only at the highest level. I think it's the platinum or diamond level. I think it's like $2,000 a month. Um, or you can just get lucky and find people who are really good at Facebook ads. Like Lee was saying, Lee's got on this actual live stream. Lee's got some people who, or he's got some opportunities. I might be thinking too far ahead. I'm currently a clinical trial associate, looking to work my way up. I want to own and open a site one day. Is this realistic? Of course, it's realistic. But as a clinical trial associate, you're doing like just a narrow number of functions um, in the industry, right? It would be much better if you were a clinical research coordinator looking to open your own site, because now you're doing a wider range of tasks in your day job that you can immediately transition over to your business, your site. But it is realistic if you put in the work. The hardest thing you got to do when you're starting a site, you got to get the PI. So get the PI and then make sure the PI has patient database so you don't have to worry all the time about where you're going to get these patients from. But no matter what, sites always need patients for their studies. So patient recruitment is a great way to get your foot in the door. So that's my comment to that question about the CTA. A lot of CTAs out there. That's why I did that video earlier today about CTAs. What else? What else? Who else is on here? Lee's the man. Like, you guys email Lee. Lee's in the Patreon too. Patreon.com/dancefair. I got to push that. We do monthly masterminds. When we get to 50 people in there, we're going to do twice a month masterminds. How much money is required? How much money is required to open a site? Could be zero. Could be zero. Go to the blog. Go to my website, theclinicaltrialsguru.com. On the welcome screen, you will see a bunch of different categories. Click on open a clinic. It's going to show you exactly down to the office furniture what you need and about how much it costs on Amazon. Uh, Patreon is awesome. Thank you. Yes, yes. I work for 3Wire Patient Recruitment. It is only a contract hourly. Yeah, 3Wire is they do, like, they're hired by sponsors to do central campaigns. They give good leads every now and then. It always depends on the study. Um, I think with your skill set, you can go to sites in your area and tell them, you have a resume, uh, and let them know, like, especially if you want to be a coordinator or if you want to start, I think you wanted to start your own patient recruitment firm. You can definitely do that yourself. I mean, it's not that complicated. The hardest part is getting the sponsor contracts, but when you're starting out, you're probably going to want to work one on one with the sites. Sites are usually stingy, so they only want to pay based on randomization. So you got to be really good at what you do, or else you're not going to eat. You're not going to take anything home. Sites are not like sponsors, where they'll just write you a blank check and say, hey, take care of our recruitment problem. Most sites don't do that. Most sites are going to say, I'm not going to pay you unless it's very reasonable for screenings. But if we get a bunch of screen failures, I'm going to end our relationship. I'd much prefer to pay you per randomization. But then you could charge more for randomization. You can charge like $1,000 for per randomized patient to the sites. But then you better be good. You better be good. And you better not underestimate how difficult it is to get even one patient randomized. Patient recruitment is the hardest thing, the most challenging thing in clinical research. Absolutely. Does the CRA program teach about budgets? The one that starts at the end of the month. The CRA, no, but the CRC program does teach budgets. So CRAs don't have to deal with budgets, so we don't teach that in the CRA Academy. But in the CRC Academy, we are training generalists, all right? We're training people that can theoretically go out there and run an entire clinic, business and everything on their own. And our biggest customers have been sites wanting us to train their staff. Okay, so CRC Academy, we have in the CRC Academy, we have an entire section on budgets taught by Monica, who I don't see on here. Um, yeah, if you're only hourly, I mean, they're paying you hourly. Like, my advice to you, if you really want to start your clinic, obviously you're getting an hourly fee. Whether you recruit patients or not, you're getting paid because you're working for someone else. If you go out on your own, you have to start producing. Like, patients going to have to randomize. It's not enough to just get leads that get screen filled. You have to randomize these patients. And until you're confident in your ability to do that, I don't think you should start your own business now. Or I should say, don't quit your job. Keep your job, start a side business. Watch out for whatever non-competes you signed. I'm not an attorney, nor do I play one on Instagram or YouTube or LinkedIn or Facebook. Well, I'm not on Facebook right now. I don't know what. Facebook's always causing problems with live streams. The CRC is the one for coordinator. Yeah, the CRC Academy, Gabby. Absolutely. Direct message me if you're interested in that. 303 so far for the vaccine. Is that how many patients you've got? Well, okay, but you're also dealing with like one of the most easiest to recruit for indications, which is people like COVID vaccine and COVID treatment. Those are easy. Hey, Ro, Monica's in class. That's right. Monica's teaching the CRC Academy class right now. She's probably teaching your competitor how to negotiate budgets. So we need to get your staff in our class, all right, so that you can have an entire office of generalists that know what they're doing. Oh, okay, you're in. Okay, good, good, good. So good, you're in good hands. Tell me how it goes, and we need to interview you after you're done because I have yet to interview someone who completed the CRC Academy. We've had many of our CRC Academy students go on to get hired. Same with the CRA. I've been interviewing a lot of the CRA. I haven't done much of the CRC people, and we need to do that. That's been a New Year's resolution of mine. The light just went out. The light went out. I'm in the dark, but it actually is better lighting in the dark. Let's turn it off and see. I got to get some duct tape for this thing. Yeah, it's actually better lighting this way. Much better. How's it going, Casey and the Sunshine Bandy? Yeah, it's perfect. The lighting is Awesome. Cilantro beets. I love cilantro. Was just talking about that yesterday. I think it's underrated. Cilantro is extremely underrated. Since we live in a virtual world, well, apparently, are there any specific recommendations you would say to watch out for? In what context? There's a lot, of course. A lot of charlatans out there. Okay. I opened my own site. The DSCS has been amazing. Oh, yes, Gabby, of course. Okay. You're the next success story, I'm telling you. You're the next success story. You and Lee. Lee, who's also in this live stream. You guys are killing it. Okay, Lee's been killing it with the COVID studies, which are like the lowest hanging fruits right now. Um, but yes, absolutely. How's it going, Ro? We need to line up people, success stories from the CRC Academy, so I can interview. Another question: would an MBA be beneficiary in clinical research? Probably, if you're trying to be a project manager. If you're trying to be a project manager, um, master's degrees still matter to sponsors. So MBA is good for project management. Um, I have an MBA. I don't find it useful um, as an entrepreneur, but I'm a business owner. Um, it probably didn't even help me get my CRA gigs. I think all you need is your bachelor's. Bachelor's of science would be preferred, but you don't even need a bachelor's of science. Black women in clinical research. I love the calendar uh, promotion you guys had. I'm looking forward to getting my calendar. Should have done the CRC before opening, but we are getting there. Yeah, it's okay. I mean, it takes a while to get some studies unless the industry is super busy, so you may not have time to prepare, and you're going to have to learn on the fly, as I did when I got started way back in the days of 2005. Can you believe that? 2005. Uh, sure. Yeah. So let's see what other questions I missed. And I know I had another one. Keep the questions rolling. I do want to watch Alabama, Ohio State, but we have time. Uh, what else we got here? Oh, here we go. I'm very interested in clinical trial. I have an MD from China and a PhD background and 1 year clinical trial management experience. Could I ask if I should prepare the CRA or CRP certificate? So I think what this person's referring to is like, should you get CRA certified and ACRP certified? The answer is, of course, you should. But if you haven't done, okay, you've done 1 year clinical trial experience. For the SOCRA and the ACRP, I think you need about 2 to 3 years of experience before you can even qualify for the tests. So if you just immigrated here, um, I would get more experience under your belt. Okay, definitely get more experience under your belt. There's the link to the calendar. Chris has been helping me like crazy. You guys are awesome. Chris is I don't know how he does it. The guy is amazing. I mean, no wonder he doesn't come on the podcast that often because he's busy. And everybody needs to add Lee. I love that all you guys on the Instagram and on the live streams starting to connect with each other. I see Carla on here. Topaz Clinical Research in the house. Is everybody going to be on the Latinos in Clinical Research Zoom call tomorrow? I don't know I forgot what time it is. I think it's 2 p.m. Pacific time. Is everyone going to be on there? If not, it's not too late. Go to latinosinclinicalresearch.com. You can be any background whatsoever. Okay, any background. You don't need to be Latina to join. You could be any background. It's a networking. It's networking. All you people asking about jobs, you need to be on there. You have nothing to lose. If the conversation turns into my company's hiring or this company's hiring for that, or do you know anybody who wants to work for, you're there. You can speak up at that point. Okay. Dan, thank you for everything. You're the best contributor to clinical research community on the internet, on the entire interwebs. I appreciate it. I appreciate it. Carla Francisco from Topaz. I'm looking forward to the Patreon mastermind on Wednesday. Let me get to some of these questions. I skipped a few. How much money can the site produce? Is it worth it? Oh, I wish I could interview Lee right now. Okay, Maximus Racing. Um, the whole staff signed up for the group. I love it. Latinos in Clinical Research is on Zoom, but you got to go to latinosinclinicalresearch.com. I'm literally sending an email out like 2 hours before tomorrow with a reminder. So if you haven't subscribed yet, go subscribe. Also, Black Women in Clinical Research. Go to that. We have Danielle on here right now on Instagram, so add her, all right, and get to know her. How much money can you make if you own a site? You can make a lot. Okay, you can make a lot or you could lose. Depends. In a year like last year and this year, when you have the added bonus, I hate to say bonus, but it's a business. We have all these COVID studies that their sponsors are literally desperately seeking sites for these studies. There's too many of these studies. They're making a lot of money really fast. Okay, vaccine studies and viral type of studies tend to focus on high volume of patients, quick studies, and pretty good budgets. So I know some clients that literally just signed up with us like a few months ago. They're on pace to make over seven figures in their first year. Normally, you start slowly. Like if this were a normal year with no COVID and just normal, like 2015. 2015 was about as normal a year as I can remember. All right. It wasn't bad. It wasn't great. It was just normal. If you were starting out in 2015, realistically, you can get 3 to 4 studies your first year. You could probably make, if you're moderately enrolling, between 200 to 300K gross per study per year. So if you're getting 3 studies in a year, you can make, let's say, 200 for each study. So that you're making 600,000 gross. Now you got to pay your PI, usually 20%. So that's 120 right off the bat. So now you got 480, okay, that you have in profits. Now you got to pay your rent, your employees. This is why I recommend when you're starting out that you do it yourself. This is why I'm recommending that you be a CRC. If you're serious about owning a site, you should not continue being a clinical trial associate or assistant or wherever that job is. You're working for a CRO, you're just doing one sliver of things you're going to be doing as a coordinator and as a site owner. So I would get hired as a CRC immediately. Don't quit your job. Don't quit your job. Don't quit your job. All right. We're lucky to be in this industry where we're not having massive layoffs. So don't quit your job. Apply. You're going to get hired as a coordinator. Sites need you. Learn the process. Join the CRC Academy if you have a little extra coin. All right. And then you're ready to start your site within a year. I can't keep up with the Instagram comments. It's too far. Can't imagine how much money my site has made just from something. I don't know. Just from Pfizer. Yeah. Sponsors, especially if you're a recruitment company, they write blank checks to these recruitment. It's actually pretty aggravating when you're a vendor, just a lowly vendor like me or like a site, and you see how much waste is given to certain vendors who have pre-established relationships with drug companies, and they're not even that good. It's just good enough. Um, Topaz in the house. What are top three? I don't understand what that question is. Top three what? Top three jobs in research? I don't know. I mean, it depends what you want to do. Everything depends on what you want to do. There is no answer for this.
How do you get a contract with Pfizer? They must be on a very high demand with their vaccine.
Oh yeah. So whoever wrote that
That'd be Marinelli.
just answer. I can't put anyone on the videos. I wish, but I have this thing, and then I can't hear you. I have this mic, so I won't be able to hear you. I have to fix that. Um, I could schedule an interview with both of you guys to do it. Okay. I have a master's in healthcare IT with solid knowledge in statistics and biomed research. Do you think I could start working in clinical research? Yes. Whenever I get these questions, the answer is always yes. Do you think I could work in research? Yes. You could have a background in working at a circus. It doesn't matter. Like, you can work in research. There's a job for you in research. Like I said, you can find studies for sites. You can find patients for sites. You can connect sites to clinicians. You can connect sponsors to clinicians. You can make websites for sites. You can do anything. Okay. It doesn't matter what your background. Of course, if you have a master's in healthcare IT and and s- and statistics in biomedical research, of course you can work in clinical research. Are you kidding? You can do anything you want. You just have to network. You have to get on LinkedIn. You have to put your resume out. You got to go network with sites in your area. um, how do someone with a law degree from the United Kingdom start a CRA? No experience. UK is a little harder. I do know a lot of people from the UK who immigrated to the US who were CRAs in the UK. In the UK, everything's more academic center, hospital based. Um, but you absolutely can do it. I would say you're a little overqualified with a law degree. That sometimes turns people off, but right now, like in 2021, maybe not. Maybe not. Uh, I did not establish contract, but that is what I'm trying to do on my own. Yeah, well, that's a good point. Three Wire, okay, they've been doing this for like a decade at least, if not longer, maybe 2 decades. They've established these relationships probably when you were in preschool, right? Like, it doesn't just happen overnight. Uh, this is what I'm saying. Like, when you start a business, you really have to put your life into it, and you have to have a long time horizon, like long. Things can happen quickly, like right now, this year, things happen quickly. But yeah, it's about who you know. At that level, it's more about who you know than what you know, unfortunately. Yes, the Pfizer vaccine is still enrolling. Yep, and guess what? We're gonna need more vaccine study. We're gonna need long-term safety studies for all this stuff. Like this vaccine and these treatment stuff for COVID, it's not ending. We're gonna need to do more research on these things, not less. I like this StreamYard. Gazelle, I got an emergency. Talk to you later. Okay, Gazelle, I got you. Keep doing your job. From our first CRA Academy class to senior CRA in like 4 years, I got to interview you, Gazelle, again. Okay, I know I did it, but that was so long ago. We have more audience. And now the audience is all subscribing, liking, hitting the bell button. And if you're on Instagram, hit the bell button too. I have to have a bell button. Once you have an established relationship, how do you keep it going? Do you follow up? Yes, you do follow up. Um, you in normal times you go to conferences and then you get dinners and things like that. Some of the bigger sites or bigger vendors like at DIA or at Bio or at Society of Clinical Research conferences, they throw like parties. They spend like 100 grand on parties, but it's all marketing, right? And they get all the study sponsors to come, all the decision makers, and then they have the PIs and all that. So once you make it like that's how you do it if you have like a huge budget. I've never done that myself. I've been part of those things, but I've never actually paid for one of those things. I do it on LinkedIn. I do it. The best way to keep them coming back is to give them patients for the studies. Like put patients in your studies, they're gonna come back. You don't need to throw a lavish party. Um, let's see. How many more do I have? We got these questions coming. Read your book. What would you advise to do next? Apply. Put your resume out there and apply. Go on LinkedIn and start connecting with everybody. Get on LatinosInClinicalResearch.com. Get on Black Women in Clinical Research. They're open to all ethnicities. Get on there, start networking, join your SOCR chapter in your area, join the ACRP chapter in your area. I think they're all doing virtual meetings now. Network, network, network. Network with the people in the comments. Network with the people. Go on Instagram, watch this replay because you're on YouTube. Go on Instagram and see the people who commented and then network with them. People like Lee who are growing businesses that need go-getters involved with him. Network, 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 network with the people from the. I want to get all of you guys who are requesting to be in the video, but I can't because this mic right here. Okay, I won't be able to hear you. I have to fix that. Um, Dan, aren't you thinking of doing clinical data management videos and tutorials because CDM goes along with CR? No, here's why I haven't done a clinical data management video. I don't know anything about it. I need to interview somebody. I want to interview people who know about that world. Clinical data management. I think I interviewed someone like a few years ago, I want to say, but if anyone is out there that wants to be on the podcast and provide value for other people, I have somebody in my Patreon channel actually who knows about that world, and I'm convincing him to start making content on LinkedIn like I'm doing here just about clinical data management because I think it's a huge opportunity in that space. Like huge, huge, huge opportunity. Lee, you're the man. Um, so that's why I only talk about things I know. I'll happily interview someone about something I don't know because I get to learn too. And we're trying to get people comfortable with videos and things like that. I got a position writing minutes for the IRB. Do you have any videos or material that touches on that topic? Or do you have any advice on how to be successful writing minutes? Um, no, I don't. But that's you got your foot in the door. Okay. I would stay with that IRB job for like a year. If you really like it, make a career out of it. But if you want to get into research, like to be a CRA, I know a lot of people want to be CRAs that take those kind of jobs. Just be the best minute writer you can be. Start networking with people like crazy on LinkedIn. Put that on your resume. Try to level up in the IRB somehow. Work your way, transition into a coordinator or an in-house CRA or a CRA, and then you're good to go. I don't have any advice on how to be successful at writing minutes. I don't even think I've ever done that before in my life. But I would imagine just pay attention to everything and write down everything in detail and then condense it later to make it easy for people to understand what the meeting was about. Thank you very much for your videos. I saw your info about CRAs and helped me a lot. I got the job. Look at you. Please message me. All right. We got so many people getting hired in 2020 and 2021. We have so much good news in our industry that we shouldn't focus on the bad news from CNN and Fox News. Okay. This is good news here. Uh, I've bombed half a dozen interviews. That's okay. Go to half a dozen more, and you're gonna get better. Most of my students, when they start going out and interviewing, they get better every next interview. They get a little better, and by their third, fourth, fifth interview, if you know the fundamentals, like if you try to do CRA interview without like understanding the fundamentals of source data verification, source data review, trial master file, how to handle sites that are not sending their essential documents in time. What are the essential documents? What do you do if there's a deviation? How do you handle retraining? If you don't understand the fundamentals, you're not going to be able to answer these questions. This is why we have the CRA Academy. This is why the experience is so important. But Jay, yeah, congrats on that job. Just do a good job. Figure out what it is you want to do in the future, and message me. Okay, what are the top 3 lessons you learned? Wait, what? Hold on. Oh, I got an interesting one here. Well, hold on. Let me get to this. What are the top 3 lessons you learned since 2005 until now about this industry? Thank you so much. Huge fan from France. All right. I was supposed to go to France last year. I was supposed to go to France last year and meet with people. But then something happened. Something changed the world. Top 3 lessons I learned since '05 until now about this industry. I don't know if it's a lesson, but persevere. Uh, it's not what you know, it's who you know, unfortunately. And be a generalist. Be a generalist because that leads into multiple streams of income, multiple potential. There's only so many CROs. I don't want to be blacklisted on all of them. Yeah, no, take it easy. Like, understand the fundamentals. Take a class. Doesn't have to be mine. There's other classes too. Mine's the best because we made it for that reason. Does having a PI that has consulting experience with pharma companies count as experience? Yes and no. I mean, if they ask questions like, does your PI have research experience? You can say yes. If they ask questions like, does your PI have experience conducting these studies as a PI? You're going to have to say no. Um, I mean, that's, he does have research experience or she does. Um, another lesson I learned, you're only research naive once. So that's 4 top lessons. Dan, what are your thoughts on CROs such as MedPace that make entry-level CRAs sign non-compete contracts? They're currently hiring now, and I'm unsure if I should go for it based on their history with non-competes. I feel like I have the CRC experience to go for a CRA position. I'm just trying to find the right CRO. From what I understand, non-competes don't really matter. I do know companies that have sued people. I think that's more of a threat, like to keep people afraid. I think in most states, those are not enforceable. Uh, like in California, it's a very employee friendly state. And read the fine print because usually it just says you can't take like trade secrets with you. It doesn't mean you can't do your position, right? So I wouldn't worry too much about that. I think those are more designed to make people afraid, and I don't like that strategy. But I also don't want you to get sued. Review with an attorney, but I wouldn't worry too much about it. Currently a data reviewer, how can I advance to a manager? Data manager? I gotta interview somebody with data management experience because I don't want to give you like a BS answer. Instagram. Instagram, yeah, I haven't applied there yet. I don't know if you want to with the non-competes. Any company, first of all, any company that relies on that as like as a retention tool, I have no respect for them, and I don't think they deserve to remain in business much longer. Your retention tool should be that you're a great place to work, that people want to work for you. They want to stay, not that they're afraid you're going to sue them. Hey, Dan, remember the interviews you did with Daniel, the CRA coach? The guy removed his YouTube channel and his website. Is there any alternative to his program on increasing CRA productivity? I noticed that too. I don't know what happened. And no, he was the only one doing that, increasing CRA productivity. Maybe that's an opportunity for somebody watching. Scientist and data reviewer in pharma, what qualifications would you need to be a clinical data manager? I don't know. I got to have a data manager on. That's obviously next. Could you give your thoughts on study startup positions? Some CRO have site activation specialists, startup leads, global startup leads, site activation. They're all the same. You're dealing with paperwork. You're dealing with getting sites either up and running, like activation, or identification, or activation, or leads. How's everyone getting a job but me? I have an MBA, CHRC, and ACRP Dan, can you look at my resume? I'll look at your resume. This just goes to show you it's not about titles. It's not about titles. It's about experience. And are you a generalist? Because if you've been pigeonholed into just one function, unfortunately, that's not valuable to many employers. Okay. And that's Sonic in the background. You hear Sonic. Sonic's pretty vocal. He's he's learning. He's learning. So yeah, we got the Sonic's getting famous. We need his own Instagram. Can I join your academy even though I have a degree in law? Yes, you can. Our CRA academy, the next class starts in April, but the CRC academy, which I think you would benefit from, starts right now. So just message me about that. Sonic, yes. Data management experience. Message me if you are a data manager because I want to interview you. Oh, Gabriella, yes. My Polish Canadian friend. Come on, hit me up. Let's do this interview. I feel like we need a part 2. I also work currently as an IRB administrator. And I'm still having difficulty getting on with the CRO. Yeah, it sounds like it's very narrow, like the functions, and it's not easily transferable to a CRO. Like they usually want like industry experience with operation cleanups, like coordinating, monitoring, even trial master file stuff, startup, activation, study startup, activation, all that kind of stuff. Still difficulty getting on. Yeah. All right, everybody, message me. I want to watch the Alabama Ohio State, but now that I'm going live, I'm going to go live a lot. All right. So we'll go live again sometime this week. LatinosInClinicalResearch.com. The Zoom is tomorrow at 2 p.m. Pacific time. Go to LatinosInClinicalResearch.com now. Network with people. Glistening Beauty on YouTube. Go on LatinosInClinicalResearch.com. Join the Zoom call. Let's start networking. Network with the people in the comments. Go on LinkedIn. Watch the replay. Network with the people in the comments. Go on Instagram. Watch the replay. Network with the people in the comments. This is how you network, right? Hey, Dan, I'm new in the research industry. 2 years, big move from programming manager to ETMF. If I'm assigned to work on the financial side of a study, will it help to be a CRA? No, CRAs don't do anything with financial stuff whatsoever. Guys and gals, thank you. Tomorrow, okay, we'll do more. Or tomorrow, LatinosInClinicalResearch.com. Wednesday, I'm probably going to go live with Monica because I'm going to be in the same office with Monica. We're both going to be masked up, okay? Even though I had COVID already, I'm going to mask up again. 2021, let's do it. No excuses exactly. Do you have 2021 vision? That should be somebody's tagline. All right, guys. I didn't get an email for that Zoom. You did. Check the spam. Check the spam. It's been going to people's spams. I don't know why. It's Gmail is killing us. All right. Check the spams. And I'm sending a reminder tomorrow too. But you got it. It went out to everybody. It's just probably in your spam box. All right. Thank you guys. LatinosInClinicalResearch.com. Sending an email reminder tomorrow. You can always direct message me. My whole staff is signed up. Didn't get the email for Latinos in Clinical Research. Yeah, try to check the spam. If you still didn't, Lee, let me know, okay? Because I'll send you the Zoom. All right. Thank you, everybody. See you guys tomorrow. See you guys tomorrow on Latinos in Clinical Research, and see you guys Wednesday. I'll do a live stream with Monica, and Patreon.com/DanceFair. Join for the masterminds, and talk to you soon. Bye bye.